We have some special guests coming to talk to everyone today, so I'm excited to have some company up here, and I appreciate y'all once again just allowing me to walk through what we're seeing in terms of our numbers. Next slide. So I want to start off by looking at where we are as a nation. As many of you know, over the last few days, we have set records for COVID cases, hospitalizations, and deaths. In fact, yesterday topped the previous record, and there were more deaths from COVID than there were on 9/11. And there's really no end in sight nationwide for the current surge. What began earlier in the fall has now accelerated so quickly that many states have reached hospital capacity and have limited options to send patients for care. And, not yet. With Thanksgiving happening just a few weeks ago and the winter holidays approaching, the prospect of a surge on top of a surge is quite real. And while New Orleans and Louisiana held back the rise and spread for some time, unfortunately right now we're seeing our trends, like the rest of the nation, go in the wrong direction. So we're going to go into a lot of these metrics in detail, but it's clear that all of the key numbers that describe our current outbreak are above what we have set as safe thresholds. Daily case counts, percent positivity of tests, hospital utilization, and the rate of transmission of the virus itself have all significantly worsened in the last few weeks. If you don't know by now, this data is always available on NOLA Ready, ready.nola.gov. You can click on data and view the dashboard. The State Department of Health website as well has most of this as well. So if you want to follow along with us, if you're not doing that already, you can go anytime. So here's New Orleans epidemic curve. You've seen me show it many, many times, and you're probably very familiar with it. But it clearly shows that right now we are experiencing a large number of cases surpassing our summer spikes. Fortunately, we're not at our early, really scary hotspot numbers, but we're currently seeing on average around 4 to 5 times the number of cases daily as we were a month ago. That's a huge rise. There does not appear to be any particular cluster or pattern. People are getting infected across the city from many different kinds of interactions. We'll talk about that in a little bit. So our positivity rate has been rising fast as well, over 3 times what it was a month ago. So at a rate below 2%, which is where we were for most of August through November, community spread was low. You could safely participate in an event of small or even medium size, and the chance that any one person there would have the virus was more or less negligible. Now it's risen quite quickly, over 5%. So that significantly increases the chance of coming into contact with someone infected and thus increasing the risk for you. And I want to explain a little bit of the difference in positivity rates. The state reports positivity rates by parish once a week on their website. That is the threshold that is used in state mandates. We report positivity rates daily. We do a very simple calculation of positivity rates. We take the average number of positive tests or positive cases, in a week, divided by the average number of tests. LDH has access to much cleaner data, and they are constantly looking at that data and making sure it is the most accurate and up to date. That's why they only report once a week. So while we generally are a little bit different, the trends are the same, and theirs is generally the most accurate, and it's the CDC standard that's used by other states. We're now going to be reporting both on our website so that people don't have to go to the state's website and our website to see. Next slide. So perhaps most concerning of all is the statewide rise in hospitalizations for COVID patients, very, very near the peak of the summer spike. If you remember what happened in July, many hospitals across the state were unable to perform non-emergent procedures and had to send patients hours away to New Orleans and elsewhere because they did not have beds to put the numbers of patients that they needed to. Right now, several other regions in the state are there again. They're once again approaching, or they've reached capacity. But the difference is there's no outside help available, unlike there was somewhat in the summer. You're going to hear from our frontline providers here in a minute what this looks and feels like every day. And very simply, we want and we need our hospitals to be available for everyone, not just COVID patients here or from across the state, but for heart attacks, for strokes, for car accidents. If you are sick, our hospitals are here for you, but we need to keep beds open for anyone who needs them. And we are reaching critical levels. Excellent. One of the consistent bright spots in our COVID response has been our continued high levels of testing. This is one of the ways we've been able to crush the curve multiple times. So I'm asking the public, please don't let this fantastic resource go to waste. We have seen a bit of a drop in people coming to the testing sites in the last couple of weeks, and this is, something that we're following nationally as well. But there's no reason not to come. If you, your family, your friends have any concerns about exposure because of activities that you've done, or you simply want to know your status, now is the time to come for testing. Up to 50% of cases we know may be asymptomatic and silently spreading. So the more of those people we can get to find out they're positive, isolate, and protect their loved ones, the quicker we can stop the current rate of transmission. So we'll get a little nerdy now. We've talked before about the rate of transmission, the rate at which a virus spreads. Basically, this indicates on average how many people one infected person will transmit the virus to. It might not seem like a big difference, but whenever this number is above 1, it can have pretty staggering consequences. So here's an example of that difference. Math is a little bit crude, so I apologize. So about 6 weeks ago, on October 23rd, we were averaging 31 cases a day of COVID, and at that point, our rate of transmission, which is a fancy formula that is calculated by the epidemiologists and, again, available to see on our website, was less than 1. It was 0.95, close to 1, less than 1. So what that means is that on that day, we had 31 cases. If every one of those people infected less than one person, 4 weeks later from that day, we would have 140 cases. So more, but not a huge amount. Consider where we are now, or yesterday. Yesterday, we had an average of 121 cases, and our rate of transmission is just a little bit above 1. It's 1.1. Doesn't seem like a big difference. But in that same time period, we end up with 5 times the number of cases, which translates to 5 times the number of hospitalizations and 5 times the number of deaths. When the rate of transmission, the measure of how many people one person can affect, goes above 1, the potential for explosive growth is real and can overwhelm systems and communities very quickly. So I want to revisit one of our main reopening and community priorities, and that is schools. We were very, very fortunate to be able to open our schools in September and keep them open. As you probably know, many communities have been virtual since March. They never got to the threshold where they felt they could safely reopen, and then things got worse, and so they definitely couldn't reopen. So you have millions of children who for 9 months have not been in in-person learning. We know a lot more now about the risks, the relative risks of in-person learning than we did several months ago, and we've been able to adapt. Education and public health leaders across the country recognize that keeping children in the classroom is the last thing that should be restricted when you are considering additional measures needed to mitigate the spread of a disease. And that's for a couple of reasons. So children can and do contract and transmit COVID. Serious illness is still low, and their contracting the virus really reflects the rate of community spread. So while they can contract it, it's really a measure of what's going on in the whole community. Most cases, and this is true of New Orleans as well as true of every school system that I have talked to, Most cases are not transmitted within the school building. And that is because schools who have opened have really had to double down on their distancing, their masking, their barriers, their mitigation measures, their sanitation. Where we are seeing the transmission in children is from the things that go around outside of the school day. So your sleepovers, the parties, riding together in the car, going to practice, some extracurriculars, and I know you guys are aware we've had some sports outbreaks, although none recently to my knowledge. Again, that's why experts now recommend prioritizing in-person learning over expanding other sectors, given the significant benefits that schools provide. And these benefits are not just educational gains. They are safety for children, they are nutritional support. Many of our children get multiple meals a day through the school system. And the fact that we've been able to do that has put them at an advantage compared to others. The problem is, if community spread continues, as I said, that affects children, right? If we can't make changes in our behavior now, then fewer children are going to be able to go in person, because there is simply a point at which it just won't be safe because of what would be coming into the schools. So that is a very real possibility that we face. So if I didn't paint the picture for you, we are at a truly critical point in controlling the outbreak. There are many challenges we're facing right now, which predict a continued rise in cases, percent positivity, and hospitalizations, and perhaps even deaths, as we're seeing nationwide. This comes during the holiday season, which many of us normally would be gathering with family and friends in multiple settings for weeks. And quite frankly, that is the most dangerous thing that we can be doing right now. Where we're seeing frequent transmission of the virus is in small group settings, whether it's in an individual home, whether you're out doing things, where small groups of people or medium groups of people let their guard down, get too close, remove their masks. This is particularly risky when you're eating and drinking in the course of what you're doing. You can't eat and drink through a mask, right? But oftentimes that mask comes off and then it never comes back on in a very close, intimate setting. So one person who tests positive a day or two later has exposed or infected that entire group. I think probably most of us know someone that has happened to in the last couple of weeks. I certainly do. And so because of that, it's really paramount that we consider every action we take when interacting with people outside our immediate household. As a parent, one of the hardest things to do is to say no to a sleepover or a party or a get-together that you or your children might want to do. But where we are right now, that simple social event could set off a cascade that puts our loved ones at risk. And so as our trends worsen, there are options that need to be considered, other options. As you know, if our positivity rate remains above 5% for the next week, indoor bar service will automatically cease after next Wednesday per the state rules. Orleans was one of the few parishes to be able to keep bars open during modified phase 2. We should be proud of that and proud of the hard work that we've done. We have to work hard to keep them open. Because we know that uncontrolled close gatherings are a high risk, a change in the gathering sizes might be necessary as well if those numbers stay the same by next week. The latest White House and Harvard and other top-level recommendations for Louisiana endorse that gatherings be severely limited or banned for anyone outside your immediate household. Other states have limited the number of individuals who can sit at a table together in order to mitigate that maskless exposure and keep the transmission as low as possible. Crowds of all size, because the percent positivity rate is much higher than it was, now carry increased risk of a symptomatic or asymptomatic carrier in that group. So steps like this to limit sizes, to limit bar service, these are not steps that anyone wants to take. I certainly don't. And I think I can speak for the administration when I know they do not as either. We have collectively worked way too hard to preserve life, healthcare capacity. We have to continue to come together as a community to protect each other's safety, each other's businesses, each other's lives and livelihoods, because they are completely interdependent. There is hope on the horizon. As we sit here today, the FDA is discussing the emergency use authorization of the Pfizer vaccine. We should know by this afternoon if they will approve it. It's expected to be approved. I have read the detailed briefing documents provided to the FDA, and I feel confident that this vaccine is safe and prevents severe disease. So when it is my turn to get it, I will roll up my sleeve and be as far up in line as I possibly can. There are two, of course, promising candidates that are both in line for authorization, and there are a few others nearing completion of their trials. But just with these two, it's going to take months to get through that first priority group of our healthcare workers who are at high risk because of direct exposure, and long-term care residents and staff who certainly are at the highest risk of severe illness and death. Further prioritization of these vaccines or others that come to market are going to be based on CDC recommendations and balance the need to protect life with the need to ensure equitable access for those disproportionately hurt by the pandemic, both physically and economically. It is critical to note that modeling shows us that the better an outbreak is contained when vaccines are rolled out and vaccination begins on a large scale, the more effective that vaccine is. If we continue on our current caseload and rate of spread, it is going to be that much harder and take that much longer to reach the immunity levels we need to get back to normal finally. So what we need to do to stem the tide is simple. It has not changed. This is a nice graphic that CDC finally put out. I'm really glad that they did. And it sums it all up. Wear a mask at all times outside your house. If you are doing your personal recreation, if you are running in Audubon Park, you do not need to wear a mask. Every other thing you do outside your house, you have to wear a mask. Keep your distance from everyone who does not live with you. Wash your hands, avoid gatherings, get tested, protect the elderly in our healthcare workforce. This is our holiday present to each other, showing we care enough to be safe for the season. So data is important, and I think it's critical to understand the pandemic and make consistent, sound decisions, and for everyone to know really what we're seeing so that we can be completely transparent. But, you know, this is a really personal crisis, too, for all of us. And so if you'll indulge me, I want to share a quick story before we hear from our frontline personnel. I'm an emergency physician by training, as you know, and we see the worst situations you can imagine, and some you probably can't imagine. We are trained for it. We are ready to handle everything. I had an opportunity to be in a hospital recently where there was a patient hospitalized for COVID who was initially doing fairly well, but as often happens, decompensated pretty quickly. I watched a team of about a dozen ER and ICU staff, doctors, nurses, respiratory therapists, everybody you can think of, put their own fears of exposure, their own fears of their health at risk to attempt to save this patient's life for quite a long time. Ultimately, they were not successful, which is unfortunately also not uncommon with sick COVID patients. That wasn't unusual. What I saw afterwards was something that I really had rarely seen before in an emergency care setting. Multiple members of that team in tears or silently really wrestling with grief and the loss that they had just witnessed. And these are seasoned emergency and critical care personnel. We do not cry very often. It is a rare, and especially not a number of us all at once. And I can't say for sure why each of them was upset, but I believe there was a few reasons. The sheer exhaustion of giving their all for similar patients over and over and over again for the past 9 months, coupled with the knowledge that much of this could be prevented with really simple measures and behavior changes, and probably some fear for their own safety and what they might be home for loved ones. So even if you think COVID's not going to affect you or shouldn't stop your desire to do whatever you want to do for the holidays, please, the next time you're considering attending a party, not wearing a mask, letting your guard down, please think of them, think of that team, and do what you can to make their jobs just a little easier. So I'm going to turn it over to my colleagues who can express this, I know, more eloquently than I can, and then after that, we'll be happy to answer questions. I'm really pleased to have with me today LaToya Cantrell. She is one of the emergency nurses at the ER at University Medical Center, and Lieutenant Stanley Woods, paramedic with New Orleans EMS. So, LaToya.
Good morning, everyone. Thank you for having me. Like Dr. Avegno just said, I'm a registered nurse at University Medical Center in the emergency department. Been there for 6 years now. And I stand here before you today asking you to please adhere to the guidelines that our administration is putting forth before us. This is not a punishment. This is to protect us. We need the community to help us bring the numbers down, and we're imploring everyone to please help us do this. It is a very trying time, and we love our community, we love our families, we love the people that are before us, that we meet every day. This is a loving, caring community. We want to gather, we want to share, we want to laugh and listen to music and enjoy all the things that this city offers, but if we ever want to get back to a place where we can do that again, we must do what we have to do now so that we can do what we love to do later. We're doing our best that we can to take care of our patients. I'm speaking as a nurse, and my colleagues and nurses within our community, we are doing our best, but we are tired. And we have been fighting this since March. It is what we are bred to do. It's what we signed up for. It's what we love to do. And we do it fearlessly, and we have been doing it relentlessly. However, there has come a time, and the time is now, where our nurses and our healthcare providers are experiencing fatigue, mental stress, physical stress. And as our numbers are rising, we see our nurses' numbers diminishing, and we have a hold on it now, but if we don't come together and do what we need to do as a community, I'm afraid that might not be so in the future. It's been 9 months, and we are pretty stretched to our limits. Because this virus is spreading more quickly, our healthcare workers are also getting sick and becoming affected with the virus. I ask personally as a nurse, with my patient experiences, and what I love to do most is care for my patients and be at the bedside with them and to nurture them and care for them and nurse them back to health. But the way I nurse, I can't even do that anymore, and that's a shared perspective from the rest of my colleagues as well. It's disheartening to have patients that you can't go up and immediately touch or immediately help, because you have to don on, don off your PPE. It's gowns, it's masks, it's our respirators, not just surgical masks, but we have to put our respirators, our gowns, our face shields on every single time we enter a COVID positive patient's room. And although we want to help our patients and we're there to do it, that gets exhausting. We just need everyone to hold on a little longer. I know it seems rough. I know it seems like, when is this going to end? From my personal experience, I definitely too miss my family gatherings, miss my friends, miss everything that could be happening, but we have to do what we have to do. And that's what's most important. We have to do it for ourselves. We have to do it for our friends, our community, our loved ones, and our children. We are all essential, and I don't want that to be mistaken. Every single life, every single person that we come in contact with, that we touch, every life is important, and it's essential. So I ask that you treat it as such, and let's just do what we can do now. And do what we must do now to save our community and save our people. Thank you.
Morning, you all. My name is Lieutenant Stanley Woods with New Orleans EMS. I've been tasked today to kind of come up here and talk about kind of a personal account of COVID-19 and everything that has been going on with myself, City of New Orleans EMS specifically, for the last 9 months. So I've been in EMS for approximately 8 years now. I've been with New Orleans EMS for almost 7. But I have to admit that the last few months have been, kind of the hardest. And I think everybody kind of shares that sentiment, everyone in this room and everyone around the world. So my first exposure, and I want to say exposure, I want to make sure that you guys know, full PPE, the first patient that I was exposed to with COVID-19 was March 18th. So that was several months ago. Now, of course, I had, gown, mask, respirator, goggles, gloves on. But that was the first time that it became like very real for me. Okay. The second time that it really became very real for me, it was when my wife was diagnosed with COVID-19. Of course, that automatically meant that I was on a 14-day quarantine, which turned unfortunately to a 21-day quarantine, where I was at home taking care of my 2 children. I got 2 small girls, and making sure that we were all safe and we were all healthy while trying to, do my best to care for my wife. And so those are the 2 very personal times where COVID-19 has been very real for me. So presently, we are still seeing several COVID-19 patients on a daily basis at New Orleans EMS. I'm not in charge of the stats, but I can tell you that there are several patients every single day that we are seeing. We are dispatched to these patients that are known to be positive COVID-19 patients. Unfortunately, what we also are seeing are patients that do not know that they are COVID-19, or they are symptomatic and they simply haven't been either tested or they're still waiting for results. And through follow-ups after we are transporting these patients to the hospitals, now that we are noticing that they are COVID-19 positive. And so for that, I urge everyone to just follow the CDC guidelines, and let's just make sure that we are all wearing masks. It's something that we are very adamant about at New Orleans EMS. Respirators, masks, gloves, hand hygiene, just everything along those lines to make sure that we are keeping ourselves safe and keeping everyone else safe around us. So I segue into, whether or not I'm going to take the vaccine when it is offered to me. I definitely will take the vaccine. And the reason why is because children are not, from what I understand, it's going to be, frontline healthcare workers that are going to be first in line for this vaccine, and I fall into that category. And for that, my children, my family will not be able to take this vaccine. And so it's something that I can personally do to help protect myself, help protect my family, and then also help protect the community that I serve. And so I encourage people just to continue being diligent, wearing masks, washing your hands, hand sanitizing, social distancing, physical distancing, so that we can kind of really get ahead of this. We're seeing an increase in numbers at New Orleans EMS for COVID-19 patients, but we're also seeing an increasing number of our healthcare workers that are suffering from provider fatigue. It's something that we've all talked about, but also, we are getting sick as well. And so I truly urge people to be diligent about following all the CDC guidelines so that we can kind of, tackle this, combat this, continue what we've been doing, but really get ahead of the ball when it comes to COVID-19. So thank you all for your time.
Thanks, Toya and Stanley. I've already put them on the spot and said they had to answer questions too. So if you want to ask them any questions, I'm happy to share.
I spoke with the Saints Vice President this morning, and he said they've been in constant contact with you all. They were supposed to go to 15,000 fans in December. They understand they won't be able to do that. Do you have a number? And also, with other major sporting events like the New Orleans Bowl and the Sugar Bowl on the horizon and the Pelicans starting their season, what is the plan handling those events going
Yeah.
forward?
Travis, how did I know you were going to ask a question about football? Fletcher, sorry. See, you fooled me. I can't tell with the mask on. Well, then it makes more sense. Yes, so actually we have been in constant communication with the Saints. I talked to their medical team yesterday. few weeks ago, anticipating this might happen, also knowing that the Pelicans are starting, we've got the New Orleans Bowl and the Sugar Bowl, and you know, a new season happening, we came up with some metrics by which they could either continue on the progression, because whenever, you know, when we made that initial progression, you know, it was always contingent on the fact that things were continuing to look good, right? So we provided them with that, and it was pretty simple thresholds, and it's exactly what you've seen here. So we, what we said is that if the case counts are below about 100 a day on average, and the percent positivity rate was below 5, then we could proceed on the path that we had set. If one of those was not favorable, one of those was in the wrong column, then they would just stay where they were for the week before. That's what I was hoping the Saints would be able to do, the 6,000 that they had a couple of weeks ago. But unfortunately, both metrics, that our percent positivity rate's above 5% and our case counts are above 100. And so the condition then was that they would go back. So for now, what we recommended to them, what we've told them, is that they would go from 6,000 to 3,000 for this upcoming game on the 27th. And that's a continuous thing. We're going to look at that every week. You've seen other stadiums do this, right? Atlanta did not have 6,000 fans in their stadium this past week. So a lot of, and you saw San Francisco have to go to Arizona. The Pelicans, we had also worked out a similar matrix. Again, like we did with the Saints, starting off very small and seeing how things go and then progressing up. Obviously, Smoothie King is smaller than the Superdome. What that 3,000 is for the Saints is about a 4% capacity in the Superdome, and that's where the Pelicans are starting as well. So that is our goal, to be very consistent across stadiums and arenas. So right now we have to be at that 4% level, which is very manageable and very doable. And then week by week, as things either stay the same, get better, or get worse, then we would make adjustments.
So what would the number be for a Pelicans game, and when are we looking at that, Dr.?
It's 19,000. I think it's right around 750. I'd have to check my math, but that's what we've communicated to them, both to their medical team and to the leadership there. I don't exactly know when their first game is.
The 27th.
Okay, so it's the same, it's the
The Saints are the 20th coming up.
20th, right, and the Pelicans are the 27th, right.
The way things are currently, would you say it's safe to say bars could expect to be closing next week?
Yeah, unfortunately I do, and we've communicated that to the hospitality industry yesterday and are continuing to talk. So just as a clarification, it's indoor bar service will close, outdoor will be able to remain open per the state guidelines. It's still a 25% cap, but it will be able to happen outside.
What other capacity restrictions do you expect next Wednesday?
I think if, again, our numbers are still where they are right now, we are going to have to look at gathering sizes. Right now, it's 75 outdoors, it's 150 indoors. You know, and while I appreciate Governor Edwards sort of making those changes, really he brought the rest of the state in line with what we were already doing. And I don't know, it really seems like it's not going to be enough. It's not the recommendation of every public health body that a state in our situation would have that many people at gatherings, allow that many people at gatherings. So that's one of the things we're looking at is really, you know, decreasing that size.
What number would you suggest?
I think it ranges from what other states are doing, I'll tell you that, and that's what we're having the discussion on, is really anything from your immediate household to no more than 25 is what most places have done if you look across the country.
So a
So-
gathering could be limited to just 25?
Yeah, or even less.
And one last question, is there, you were talking about the strain on healthcare workers right now. Is there any concern about a shortage of healthcare workers within the city, and any plans to bring back the convention center setup?
Yeah, it's really staffing. It's not beds. There is a nationwide staffing shortages because nurses that can travel are getting pulled to wherever needs them most and really what can pay them the most. I haven't heard from the state whether or not, I know they always have that option on the table to reactivate the convention center, but we have the physical beds, and I don't know, Toy, if you want to sort of speak to this, it is the people that we're running low on, and there's no reserve to bring them in. Toya, you want to talk?
Sure. So yes, we definitely have space. Space is not the issue. It's our staff that we don't have. And for every patient, it's not a one-to-one ratio. So there's a physician, 2 nurses, and I'm talking about for our sick COVID patients, at least 2 nurses. We need a respiratory therapist. We need our techs available, depending on what the situation is, how bad that patient may be. There's a lot of ancillary staff that comes into that. So when we're speaking of our patient population and and the beds that we have available, that's not the issue. So the convention center opening, I'm not sure what the plan is with that, but that's really not the problem. At UMC, the beds are there. It's the nurses that aren't.
How are you doing on equipment, gear, masks? Are you in a position where you have to reuse?
No, thankfully we are at a great place to where we are not reusing PPE. We're safely donning and doffing appropriately like we're supposed to. I don't foresee us being there. I think our hospital and our state has done a wonderful job getting us the things that we need. So yes, we've been able to protect ourselves, the best way possible. Thank you.
WWL followed by the Advocate.
Thank you. Dr. Avegno, can you explain, and are there any other contributing factors in small group settings as to the reason why we're seeing the uptick with cases here?
Yeah, well, it's sort of the perfect storm because most of them are indoors now, or more. Well, let's just say this: more people are moving indoors, right? Because it's cold for us. I think New Yorkers would probably laugh at us and be eating outside. But it's you start, and I think we can all relate to this. I know I personally can. You start off on your best behavior. Let's say you went to somebody's house for dinner and there's 4 of you. You start off with your mask and you're kind of talking apart, but then when dinner comes, you've got to take that mask off and you probably aren't really 6 feet apart, and then that mask stays off for the meal and the cocktails and the desserts afterwards, and then you sort of forget, oh wait, I really needed to put my mask on. So it's the amount of time too, right? It's different from I'm going to my workplace, I'm going to sit in my office by myself, and anyone who comes in my office, I can make, it's a little more formal. We can make it where even at office settings where we're seeing transmission happen, it's because we ate lunch together in the break room. So there's nothing inherently dangerous about eating or drinking. It's just what we do in order to do those things, and then we're not really vigilant. Like my husband makes fun of me because, if we're eating somewhere, outdoors at a restaurant, I put my mask up, I take a bite, and I put my mask back on. But that's really the safest way to do it.
The Advocate. I just want to know if for parents in schools, if either you or any of the front line workers here had anything to just sort of encourage parents who are kind of dealing with stir crazy kids.
Yes.
Who want to go to the sleepovers and activities, say something to them.
Oh, I have very personal experience with that. I personally have just worked really hard with my kids to encourage outdoors activities, right? Can we go to the park? If you want to do a gift exchange with your friends, let's do it at the park, right? And we're fortunate we can do it at the park. Or even, can you see a movie, right? Because when you see a movie, you can sit apart and you're not moving and you're not getting close, and you can mitigate that. Let's go walk downtown and see the Christmas lights, right? Let's do things as a family. They're definitely stir crazy. It does not make me the most popular mom, that's for sure. But trying to say the more we do this, this is not forever. You'll still be able to have those sleepovers. Let's just get through the worst of this. And then you'll be able to have maybe some more, and then hopefully in the summer when everybody can get vaccinated, we hope, then the sleepovers can come right back. It's hard. They are stir crazy with Christmas coming. You have to be really creative about finding ways to still make them feel in the holiday spirit. I don't know if either of you want to talk about what you do. You have younger kids.
Yeah, we have. Stanley, you want to?
All right, yeah, I can definitely attest to that, especially as I said earlier, when my wife was sick with COVID. I have a 5-year-old who had to do virtual learning, and also have a 16-month-old. Hands were very, very full. But definitely, my 5-year-old, she definitely has a 5-year-old's understanding of the virus, and so there's a lot of explaining. And I think that the communication is possible because she's 5, but the communication is definitely very, very important. To make sure that she understands that, hey, look, there are going to be some social distancing issues. There are going to be, you're not going to be able to sleep over with friends and family members in any regard until, the vaccine is made widely available. And for that, like I said, it again, just like Dr. Avegno said, not the most, it makes you not the most popular parent, but it's a safeguard that I think most parents or all parents should be willing to make. So.
I'd like to take a moment to speak to the parents. I am a mother of a young son, he's 4, who's just switched to hybrid learning, so he attends Monday through Wednesday. Virtual learning Monday through Wednesday and attendance Thursday and Friday. Becoming an educator immediately, just at the drop of a dime, is not an easy thing to do. And I have sympathy for all the parents who are doing it and who are put in this position to have to do it. I encourage you to try and search for patience, search for understanding. Your child can be a total different human being at home than they are in the classroom. I know that parents are put in positions to where they have to work. We still have bills and responsibilities, and yet now you have to make sure that your child is educated at home as well, and that can be challenging. Fortunately, I've structured a schedule to where I can assist my child during this time, but I know that everybody is not that fortunate, and my sympathy is with you, and I encourage you to pull together with your neighbors via telephone or Zoom, ask questions. It's not a secret. Everybody's going through this together. Talk to your children's teachers. Reach out as much as you can to get as much understanding as you can to help our children through this, because this is new to them too. Although they're pretty with it. I'll say my 4-year-old, he's pretty on it. Coronavirus, I'm going to wear my mask. That's a lot of people, mommy. So I'm proud of our youth. However, we are put in this situation, and we have to make sure that we're doing what's in the best interest for our children, as hard as that can be. So in that same statement, we must continue to wear our masks, still social distance, still wash our hands, continuous hand washing, and practicing it with our children so that when they get back into the school setting, hopefully they can remain there. Thank you.